This teachable moment is brought to you by the Jewish Healthcare Foundation and the Pittsburgh Regional Health Initiative. The staff at UPMC Shadyside Hospital 3 East was seeing the same family health center patients too often, so the staffs got together and developed a protocol to bridge the gap between inpatient and outpatient care.
I had a lot of concerns about seeing the same patients reappearing on 3 East. Concern whether how they were taking their medications at home, whether they were following up with their physician, as directed. We were seeing them too frequently. History showed that the 3 East Family Medicine Unit and the Family Health Center shared the same patients, but we never really had a relationship with each other. We had to come up with a new process for the discharge and that transitioning from that inpatient to an outpatient setting.
Ms. Williams.
Now upon discharge, the physician goes into the room and talks to the patient about discharge, but hands out a business card with a number on it, something for that patient to hold that they remember. It's written, it's something that they can touch.
So let me just give you my card. You can call, there's a phone number right there for the Family Health Center, and I'll see you at the Family Health Center in 2 weeks.
2 weeks?
2 weeks.
Okay.
Okay? All right. Good working with you.
Good morning.
Good morning.
Hey, I heard that Dr. Southwick stopped by to talk to you this morning.
Yes, she did. Yes,
You're going to be discharged?
I am.
Okay.
I am.
I have some discharge information for you.
Okay.
I really like for you to set up your discharge appointment from here.
Okay.
Okay.
All right.
Do that?
Sure.
Okay. Number's right on the bottom of the card.
Okay.
And you dial a 9 to get out.
Family Health Center, can I help you?
Yes, hello. My name is Margaret Williams, and I'm calling to make a follow-up appointment with Dr. Southwick.
Okay, let me see what we have here.
She told me 2 weeks.
How about October 15th at 10:30 with Dr. Southwick?
October 15th? Okay. See you then. Thank you.
We had certain elements that were missing before. Now we were putting the pieces in place.
So, I have a pillbox for you.
Having a pharmacist go in and talk to the patient about old and new meds made a huge difference. Pharmacist would see the patient, and then the pharmacist here, same one. Once again, the consistency would call the patient 2 or 3 days after discharge.
Well, I'm calling to check in on you and your medication use.
That voice, the name, they remembered it, and it let them know they mattered. And then the patient would come back to the Family Health Center and see the same physician that they saw upon discharge.
Hello, Dr. Southwick.
Hey, good to see you again.
Nice to see you.
All right.
It was a perfect group of people at a perfect time that gave the perfect recipe for success and sustainability. Everybody is clear of their role, and the goal and the focus has never changed. Even though we have individual roles, we work very well as a team. The goal for all of us has always been the patient and helping them transition with their care. Recognizing that smooth transition is essential to optimal patient outcomes. The baseline data demonstrated only 46% of patients had scheduled and attended their follow-up appointments. After changes were put into place, the percentage of scheduled appointments increased as high as 80%, with a show rate as high as 73%. Overall discharge satisfaction improved from the 11th percentile to the 48th percentile. How to take medications after discharge improved from the 10th percentile to the 90th percentile. Once again, we're letting them know that they matter, that their participation matters, and that the follow-through matters.